We want to bring in Dr. Dana Bitner to break down this huge news and to talk about how this will make these treatments more available to so many women that may have been scared off by that daunting label.
Exactly, and you started it off so well in terms of the history of this label and what this label looks like. It's got a black box around it, and what this does is call out information that we now know for menopause hormone therapy is outdated.
Right, and we've heard from women that talk about finding a doctor that listens to them and will prescribe them a treatment that will help is already challenging enough. And then if you get that treatment and you've got that warning on it, it would definitely make you think twice before actually taking it.
Actually, after having a good conversation with the patient and going through all the pros and cons, she gets home and sees this label and she's like, who am I supposed to believe?
Right.
And this looks really scary, but this information applies to women who were in the study. They were older. They were over 63. They had no menopause symptoms anymore, and they had been more than 10 years from menopause. So this information does not apply to most women who are at their doctor seeking out information for menopause hormones.
Yeah, but there's so many health consequences that can happen as a result of menopause. And let's talk about when is a good time to begin the treatments, because the timing of starting it before the age of 60 seems like more beneficial.
Yeah, we've got a lot of good data that if you start hormones in the first 6 years after menopause starts, so 6 years, then you have the most benefit in terms of potentially lowering your risk of cardiovascular disease, risk for diabetes, risk for osteoporosis, risk maybe even for dementia. So we know that those studies are building. We know if we treat the symptoms, we can improve women's health.
Yeah.